Medical experts have termed the malaria vaccine as a new weapon in the fight against one of the deadliest diseases documented to claim at least 500,000 people every year, most of them in sub-Saharan Africa. The World Health Organization estimates that Africa accounts for 94% of the global malaria burden. Director General Dr. Tedros Adhanom, himself a malaria researcher, made the historic endorsement on Wednesday.
This vaccine is a gift to the world, but its value will be felt most in Africa.
In Africa, where the disease is endemic, the news has been welcomed as a historic breakthrough for the continent's fight against the disease.
So having a vaccine that shows that level of effectiveness or efficacy in preventing severe illness and death in children is remarkable. I think it must be celebrated as a significant breakthrough in the last 100 years that we have lived with malaria on the continent and other places. Malaria is a uniquely difficult parasite to fight because of the way it keeps evading the immune system and the way that the different forms that the immune system needs to fight with. I mean, even those living in endemic area, you need to be exposed multiple times to actually get a certain threshold of what I call protection.
Clinical trials showed that in the first year, the vaccine reduced severe malaria by 50% in young children and 1/3 in infants. But vaccine efficacy dropped to 0 by the 4th year after vaccination. Under a pilot program that started in 2019, Kenya, Malawi and Ghana have immunized at least 800,000 children after incorporating it in its routine immunization programs. The vaccine, also known as Mosquirix, is given in 4 doses spread between the ages of 5 and 17 months and a 4th dose 18 months later. On COVID-19, Dr. Nkengasong decried the decision to include African countries on the UK travel red list, which also fails to recognize vaccines administered on the continent.
I will be meeting with the UK Minister for Africa today evening, and that will be a top issue to be discussed. And if you read my communique, it was really offering an opportunity for us to sit down and mutually agree on how to move the process forward journey so that decisions are not made in certain capitals that have consequences in Africa as a whole. So I really hope that this today's discussion by the UK Minister of Africa will provide an opportunity for that dialogue to happen.
In its weekly virtual briefing, the Africa CDC noted that at least 8.3 million positive cases of COVID-19 have been reported in Africa since the beginning of the pandemic, with 213,000 deaths. Sarah Kimani, SABC News, Kenya.